So the therapeutic potential of cannabis has been explored historically for a long, long time. So far, unfortunately, this has not been approached from the biomedical science until very recently when it became legalized in different countries. So the scientific evidence for the benefits in different conditions is not yet documented for every possible condition. So here in Canada, we speak about confirmed uses of cannabinoids and potential uses of cannabinoids. Here, I'm just going to make a note that I think I didn't mention before, that THC and CBD act differently. THC is psychoactive, is the one that will go to the receptors in your brain mostly, and CBD does not go to the receptors in your brain. CBD acts by modulating the action of THC and by going to other receptors in other parts in your body. So THC and CBD have different effects. Most of the risks have been associated with THC and not with CBD, and both THC and CBD have therapeutic potentials. So some of the confirmed uses here in Canada for THC has been chronic pain and spasticity, especially in patients with multiple sclerosis. Spasticity is like some kind of rigidity of the muscles they have, and THC has been seen to help in that. Another one, a very important use, is to alleviate nausea and vomiting induced by chemotherapy in cancer patients, and to induce appetite in patients with AIDS that have something called emaciation or cachectic syndrome, in which they don't feel hunger anymore, and they start losing weight and getting very thin and weak because they're not getting enough food. So THC induces appetite in people with this syndrome. And CBD on its own has been used for some forms of epilepsy, genetic types of epilepsy that are refractory to conventional treatment. So epilepsy that does not respond to other treatments that are there, CBD has been shown to reduce the frequency of epileptic crisis. For all these uses, THC and CBD combinations have shown to have less adverse effects. So it's always better to go for a combination of both, because as I said, CBD regulates THC and it helps reduce the side effects of THC. So at first, people were going for synthetic THC. So they were synthesizing THC in a lab to use it as a medicine. But then people now are going towards leaf-based preparation, meaning extracts from the plant, because that way they extract both the THC, the CBD, and the other cannabinoids that may have a better synergy together. However, when you do the leaf extracts, it's harder to have the exact dose of what you're giving. But just to consider that THC and CBD together are better in terms of side effects. Those are the confirmed uses. Some potential uses are as an anti-inflammatory in Crohn's disease and ulcerative colitis, in glaucoma, which is a disease in which your eye pressure is increased. There is some potential use of combination of THC and CBD in post-traumatic stress, but is still being investigated. And as I said, CBD is used to decrease the toxicity of THC. So they're investigating if there's some way in which psychotic symptoms that are caused by THC may be decreased by using CBD. And in animals, CBD has also shown a neuroprotective effect. So it's an antioxidative, but this has only been seen in animals so far, so no evidence in humans. So that being said, I'm just going to close with some harm reduction advice. I think I already made some emphasis in the difference between THC and CBD. And I also mentioned how in the recent decades, we have gone towards more concentration of CBD in cannabis, which is not necessarily ideal. So my harm reduction advice in general is to use cannabis products that are lower in THC and or have a more balanced THC CBD ratio, so closer to 1. So if they have THC, also have at least some CBD in it to balance the effect. If we go for very high THC products because we're looking for the euphoria and for the psychologic effects, we will face side effects in one or another way. For the route of administration, as I said, the safest way is to vaporize, and to vaporize the leaf directly, to use the vaporizers that heat the leaf so that It will volatilize THC and CBD, but you won't burn the leaf and you won't inhale the byproducts of combustion. Vaping is safer than ingesting, and ingesting is safer than smoking in terms of lung health. But just remember that ingesting also, it's very unpredictable, the absorption rates, how high it's going to go and how long it's going to stay there. So also the side effects when ingesting can be hard to handle. So vaporizing is the safest way of using cannabis. Once again, vaporizing the leaf, not the one that has the cartridges, because the stuff that is in the cartridges has not been tested to see how safe it is for our lungs. For people who decide to smoke cannabis, the harm reduction is to avoid mixing cannabis with tobacco, because you'll have more harmful products if you inhale the tobacco as well. And avoid deep inhaling or breath holding. This is a practice that's very common in youth, like hold it in, that because it will hit you harder. That's not true. The time it takes for THC to go into your bloodstream is very quick. And the only thing you do if you hold the smoke in is that you increase the damage that the byproducts of combustion are causing in your alveoli and your bronchi. So it's do not deep inhale, do not hold the breath. Just inhaling will be enough to like release the components into your body. And a very important one that is also the case with other substances: start low and go slow, especially if it's the first time someone uses cannabis, someone's curious, someone wants to know. Start with a type of cannabis that does not have that much amount of THC. Take a little bit and then see how you react before using more. This is particularly important if you're ingesting cannabis, because it's very common that people are like, we prepare these cookies or these brownies, and then they have a little bit of it and they're like, oh, I'm not feeling anything. And then they eat more and it takes 2 hours to absorb. So when it finally hits, they have all the side effects, and it's a very unpleasant experience. So another and last harm reduction advice, which is related to legalization, is that one of the advantages of legalization is that you can know the product that you are using, because all of this is like, go for high THC, go for low THC, avoid high THC, go for CBD. But this is impossible to know if you are getting your product in the black market. They tell you, oh yeah, this has 10% THC, but there's no way to know. So there's no way to approach this in terms of harm reduction and say, what am I going to use? What am I not going to use? And also, you're not going to know what kind of cannabis made you feel better or worse. So that it's going to still be unpredictable if you use cannabis, which chemical composition you ignore. So that's it for my part. Thank you very much.